Hello, I'm Julia Alina, CEO of ReelDx, and I'm here today with Professor Brent Norris from Pacific University School of Physician Assistant Studies. Thank you, Brent, for joining me today. Tell me a little bit about your journey into education and how you became a professor here at Pacific University.
My background actually began in education. I pursued secondary education during my undergraduate to teach biologic and social sciences. Became interested in medicine while doing so and ended up pursuing a degree in physician assistant studies. I've worked primarily in emergency medicine, currently working also in some of the urgent and immediate cares in the greater Portland area while also teaching here at Pacific University for the past 4 to 5 years. It's been great being able to combine my love of medicine with my love of teaching, and so very happy here.
And how did you first learn about ReelDx?
ReelDx was something that when I came to this institution, they were utilizing minimally. I think one of the previous faculty members introduced me to it, and I enjoyed how he was able to use it in his classroom settings, and I adopted it into kind of part of my teaching and my curriculum of my courses that I instruct. I've since tried to champion its cause and introduce it to other faculty members as well, and now utilize it, I would say, in almost every course that I teach.
Wow, wonderful. So describe how you're currently using it in your courses. A couple of different use cases maybe, in class, outside of class?
Yeah, so initially when we began using it, I'd say I almost exclusively used it in class to kind of walk through cases with the students and discuss them as we went through it. Later on, I believe as certain features of ReelDx became available, I started doing more asynchronous learning with the students where I would assign certain courses or certain cases to the students. I would limit the sections that they had access to, usually allowing them to see the video, the vitals, demographics, chief complaint, and medical history, but then hiding the remainder of the information such as differential diagnosis, outcomes, diagnostic studies, and actual treatments for the patient. And then the students would review that information on their own at home. They would come to class, present and practice presenting the patient encounter as they saw it proceeding, and then would relate the information that they would see as the most likely diagnosis and what studies they would like to choose, what treatments they would likely implement, and we would discuss that in class together. There are other ReelDx cases that I utilize simply as a way of demonstrating certain procedures that the students are unfamiliar with. Also demonstrating the use of certain diagnostic studies that we teach the students kind of conceptually, but they have a hard time understanding how those are actually utilized in a clinical setting. And so there's a couple different ways that I have found to effectively utilize it in class.
And what's the feedback been like from your students about ReelDx?
Most of the feedback that I get is that we allow our students to have access to ReelDx during their didactic year. And one of the complaints, not complaints necessarily, but some of the feedback we often get from students is, I wish I could see more patients during my didactic year. And we're obviously limited in the amount of patients that we have time to allow the students to see during the didactic year. And so this is one of the best ways I've found to bring what I would say as close to a real clinical encounter into the classroom as possible in a meaningful way and to a number of students for a number of cases. And so the feedback that I get from students is, this is almost as good as seeing real patients in my didactic years I could get. I also do a lot of simulation within our school, and we've tried to incorporate some of the ReelDx cases into our simulation program as well to make the fidelity a little bit greater.
What's your favorite ReelDx case?
So my favorite ReelDx case is the one I mentioned to you earlier with that elderly gentleman who comes into the emergency department, I believe, with constipation. Looking at his medical history, you discover he has a history of back pain for which he's receiving multiple narcotic medications. Through the course of the visit, they end up discovering that probably the etiology to his constipation is a metastatic tumor of the colon, which is metastasized from the back cancer, which was causing his back pain, which metastasized from the prostate, for which he had received a procedure earlier. The great thing about it is that, once again, the ReelDx doesn't give you all the details or the information of that. You don't know. Were they aware of that metastatic cancer? Had patient declined further treatment of it? Was he being treated appropriately, or was the narcotics detrimental to his care because it prolonged the diagnosis of something that could have been diagnosed earlier? You don't know. And so you were left to fill in those gaps and have a very good discussion about not only what are the differences between musculoskeletal back pain versus back pain caused by cancer. You're able to have a conversation about the appropriate use of narcotics, not only for patients who have chronic pain issues, but also for hospice type medicine. And then you're also able to talk about complications that arise from use of narcotics, cancers, and things like that. And how do you approach pain in general in the geriatric population?
So what about the faculty? What do your colleagues say about ReelDx?
The faculty have been very welcoming of it as well. I think one of the things they like most about it is that they have cases that are pre-prepared. Cases actually take a significant amount of time to develop, especially when I'm doing cases for simulation as well as cases in the class, to get a patient's chief complaint to line up with their signs, their symptoms, the diagnostic results that match the actual vital signs of the patient, making them sick but not too sick, finding treatment options that are appropriate. And so they take a lot of time to finesse and make everything work properly, where they actually occur naturally in most patients. And so ReelDx has all of that information there for you. So my colleagues have been very receptive of it as well, and I've gotten many of them to begin utilizing it in their courses as well.
So the folks watching this video are likely either considering ReelDx for their program, or perhaps they've just started using it. What advice might you offer to someone else in your role who's just now looking at ReelDx, and some best practices or some guidance you might have help them overcome some hurdles that perhaps you've already gotten over yourself?
I think over the years it has continued to grow and develop as an online resource, and so make sure you're fully aware of all the features that it offers today, because some of those are fantastic additions that have come recently. Another thing is prepare your students to use it. I think we do a introductory course to ReelDx where we make sure that they're all signed in. They all have access. I introduce them to the features of ReelDx. I introduce them to many of the cases and how it can be utilized. I talk to them about ways that it is used in this school as well as in other schools, so that they know what to expect when they see it being presented to them, either in class or as an assignment, so that the students are familiar with it and comfortable using it. I think part of that instruction I give them is to find a way that serves them and their learning as best as possible. And some of the students have found that it doesn't necessarily introduce them to a lot of new material, but what it does is gives them a face to put to that condition. It gives them a real-world application for something that they've only really thought about in a very nebulous form from a textbook. That's the feedback that I get from students. It helps it stick. It makes it real. The feedback I give to anybody starting ReelDx for their faculty is get your faculty and your colleagues on board with it as well. It's helpful if you use it. It's helpful if the students use it. But if you can bring it into more of the courses that you teach, if you can make it longitudinally integrated into your curriculum, I think it has the best chance of giving the students the experience that they need during their didactic year.